Local programming on KRWG Public Media made possible in part by viewers like you. Thank you.
This is KRWG Public Media, TV, radio, online. News that matters. Now, across the Mesilla Valley and the borderland, the stories that shape our community. From the KRWG Broadcast Center at New Mexico State University, this is Newsmakers.
Thank you for joining us on this special edition of Newsmakers. I'm Fred Martino. This month, we are partnering with the NAACP of Doña Ana County to focus on civil rights issues. Today, equity in COVID-19 vaccination and treatment. Our guest is Dr. William Thompson of the UNM Health Sciences Center, my co-host, as usual, NAACP President Dr. Bobbie Green. Welcome to both of you. And Bobbie, I know you have the first question.
Thank you, Fred. And as usual, the NAACP is very grateful for the partnership with KRWG. Dr. Thompson, vaccine hesitancy is a problem in the state due to the reluctance and the mistrust of people of color based on past experiments and vaccine trials gone awry. What can be done to alleviate the fears of people of color who are most at risk of COVID-19?
That's a very good question that has always plagued medicine. And I think that we have to be as clear and as transparent as we can be. It's very important for people to get the same message, get the same consistent message, and just hear the information so that they can make a decision themselves. And I am an oncologist by training, recently retired, worked here at the University of New Mexico. And as a clinical scientist, it was always a struggle trying to talk with patients about clinical trials. The same process is happening now with this vaccination program. We just have to be absolutely clear, discuss the risk, discuss the benefits, and let people make that decision themselves.
So this is really an incredibly important issue, Doctor, and something that I think we can't emphasize enough, particularly now as we're seeing variants of the COVID-19 across the globe. And so if you can explain this, I think there's fear that if we don't speed up the vaccination process here, there will be more variants, and as a result, the vaccines that are out there may be not as effective.
And you're correct. I'm in the age group now that I'm looking to get vaccinated myself. I also have a co-condition, so that makes me one of the people waiting to get a vaccine. The healthcare professionals were placed in the first group. Because I'm recently retired, I no longer qualify in that particular group. So I've been acutely aware of the need and the push to get vaccine out there. But you've hit one of the biggest problems that I have come across, and that's the production. The state of New Mexico only gets about 60,000 doses a week. That's hardly nothing really for the number of people that really need the vaccination or want to get the vaccination at this time.
Yeah, and as you probably know, the website where folks can sign up to get in the queue to receive a vaccine, we're already in the neighborhood of half a million people who are in the queue already, who signed up. Some of those folks have already gotten the vaccine. As you're aware, Doctor, there has been research that indicates while people of color are the most adversely affected by COVID-19, here in New Mexico and really all across the country, particularly among indigenous citizens here in New Mexico, people of color are often among the last groups to receive the vaccine so far. So specifically looking at that issue, equity, how do you think we can improve the vaccination rates for people who need the vaccine the most?
Well, that's going to be a two-pronged approach. Number one, we need data. So we really need every state to list who is getting the vaccinations, what race they are, what county they're coming from, what city, location they're coming from. Even if we just use zip codes, that would be one method of being able to identify if the vaccine is being distributed equally. As you're aware, the first group of people were the first responders. Every state decided that they were going to try to get as many of the first responders done. And to be honest, if you look at that group of people and demographics, you're going to have a larger percentage of non-white. Now, as we roll out the vaccine and we actually start increasing the distribution, I think we're going to start seeing a little bit more equitable distribution of the vaccine. Right now, it's just the logistics, just getting vaccine, just getting it into people's arms. I think that's the biggest push that's right now.
Okay, thank you. Bobbie.
Thank you, Doctor. That's a perfect segue into my question, which is very similar to the one that Fred just asked. My question is, what is being done in New Mexico to provide a uniform and fair distribution of the COVID vaccine? I'm also one of the 500,000 people on that list waiting for a vaccine, and I'm checking the website every day. And, I think it's like a unicorn. It's a mythical beast, at least so far it has been. So anyway, what is being done in New Mexico as far as you know?
Well, Dr. David Grace has been really the lead image that we've seen on TV and in the press conference. And I've known Dr. Grace, I've worked with him before, not only at Presbyterian, but at the University of New Mexico. I really think that he was kind of an excellent doctor to be at that position at this time. I think he's doing everything he possibly can to try to make this as equitable as possible. The newest addition is Dr. Collins, who I believe will be speaking today at noon regarding how the state of New Mexico is doing regarding the distribution of vaccine. So from a state point of view, they have opened up this computer system, but let's be honest, it's difficult for everybody to have the same access. If all things were fair, everybody would have a computer at home, everybody would have the same internet access, and everybody would do the application process at the same time. It really disadvantages people that do not have access to internet or that may not be tech savvy. And for that reason, we really need to open up as much discussion as possible within the community, talk wherever we can to try to help promote people, to get them involved in this process, to help them get signed up if possible. And when we have the vaccine, get it into their arm.
And it's a good time to mention that krwg.org, we do have the link to get on that list so that you're in the queue to get the vaccine. We have the link to that as well as a link for ordering a free at-home test kit. That is another service that's being offered to New Mexico residents. They can order a test kit. And, since you mentioned this, Doctor, the fact that not everyone has internet, there also is a toll-free telephone number where you can call to get signed up for the vaccine. And we have that on our screen right now so that folks can call toll-free to get signed up for the vaccine. If they do not have internet access. So we're providing that on this program. Of course, it's also on the website. If you go to that website, you can take down the telephone number for friends or relatives who may not have internet access. Doctor, I want to touch on something that I think is very important to talk about. Certainly, Dr. Fauci has been talking about this quite a bit in national interviews for a long time, but I think it's very important for us to emphasize that even with vaccination, masks and social distancing are crucial. If you can talk about that and what your view is on how we can improve uniform acceptance of these measures. I was just about a week ago at a gas station, and I couldn't believe it because I walked into the gas station and there was a patron in the gas station there without a mask on. It's the first time I had seen that in a while, but we've seen this in parts of New Mexico and in other parts of the country, that this is not uncommon to see people without a mask on in a small space.
It's funny you mentioned that happening now. I actually have seen kind of the reverse. I remember going to get gas about a month ago and no one was wearing masks. And I think it was the message that was being delivered, and it was confusing a lot of people. We had Dr. Fauci strongly recommending that we follow the CDC guidelines and recommendations of wearing a mask, socially distancing, and avoiding large groups. But they were also getting the message from political leaders that were telling them that that's not as necessary. And I think that creates a lot of confusion for people as to what they want to believe. Does it become a political issue where you decide that mask is now something that is going to signify what you believe? Or is it a masculinity issue where only people that are sick are really going to need to wear a mask? Is it fatigue? I think all of those have a factor and play into people's decisions. What I'm seeing now, though, is more and more people are beginning to wear a mask in almost every situation. I'm happy to see that when I go to the gas station now, the majority of people are wearing a mask. It just has to be a uniform message. Dr. Fauci now is a little bit freer to be able to express and really remind people and continue to express the fact that we need to continue this despite the vaccine being available. Trouble is, the vaccine is going to be one step in all of this to get this epidemic under control.
Absolutely. And besides people like Dr. Fauci, who are very visible at the national level, and folks like Governor Michelle Lujan Grisham, who has been very much out there at our state level talking about the importance of masks and social distancing, do you think that there needs to be a lot more effort at the community level with community leaders and folks who work in the media, such as a program like this, folks who work in education, getting out there and really making sure that this is understood and accepted?
Yes, we have to keep talking about this. We have to keep reminding people. It's very easy to become tired, fatigued about what's going on and what's happening. I'm a grandfather. I would love to be able to see my grandkids, but as of now, we are avoiding even traveling. My grandkids are in Atlanta, Georgia. That was a hot spot. My oldest daughter is in Dallas, Texas. We have avoided traveling, and we want to get back out and start traveling again, but this virus really needs to be under control before we can actually start doing things like that. So
such a good point.
Over and over again helps people remember that we just have to take precautions. We have to take care of our community.
Absolutely. Such a good point. I'm a grandparent too, and I'm missing seeing the grandchildren for sure. But like you, my grandchildren live in another part of the country and not traveling right now, not doing that because, as we all know, studies have indicated that a large portion of people who become infected with this virus are asymptomatic. So they don't even know that they've been infected, and so it's very dangerous to travel and potentially infect other people. Very important. Bobbie.
Thank you, Fred. You bring up an important point. And so my next question, given all of the super spreader events, and I saw on the news that there were quite a few Super Bowl parties where people were not wearing masks, do you believe that we can actually achieve herd immunity against COVID-19 in New Mexico?
Wow. Let's talk about herd immunity. Let's talk about it with a vaccine and without a vaccine. If we do not use a vaccine, herd immunity can be achieved, but it may take decades. It may also mean millions of lives lost. You almost have to think about the Dark Ages with the Black Plague. This virus is just going to change, and it's going to find ways to defeat your immune system because it wants to live. It just wants to spread. So herd immunity can be achieved that way, but it's just going to be devastating, I think, to our society. With the vaccine, I think that our biggest hurdle is distribution. If we had 300 million doses of vaccine today, and we were to get it into everyone's arms, we could potentially achieve herd immunity in a few months. But because our production and distribution is limited now, I truly believe that we're not going to achieve herd immunity until we get the majority of Americans vaccinated, which may not occur to the end of the summer. And then we still have to worry about worldwide distribution. Otherwise, there are going to be new variants that will develop and pop up that may be immune to the vaccine that we currently have. So it's a concern that I have, and I'm hopeful that we can get this vaccine distributed quickly and fast, and distributed within the world quickly and fast.
And Doctor, correct me if I'm wrong. What I understand in the limited discussion that I've heard of this issue of herd immunity, there is a possibility with this virus that, especially since it is beginning to mutate and there have been various types of variants all over the world, that there is a chance that we may never have a herd immunity. It'll be like the flu shot, where each year there's a new flu vaccine based on the previous year's predominant flu strain. Is that right?
I think you're absolutely correct. This morning I heard that the AstraZeneca vaccine trial was stopped in South Africa because it was only 10% effective against mild symptoms for this particular new strain coming out of South Africa. That's concerning. That means that this virus could learn to defeat the vaccine that's currently available. Yeah. Now, the nice thing about the vaccines that are currently out there, the Pfizer and Moderna vaccine, are using messenger RNA. It's a new way to do vaccines, and they can quickly adjust their vaccines based off of that. And they're already starting to do that based off these new variants. So you're absolutely correct. We may need a booster shot in the fall for these new variants that are going to probably sweep the world.
I'm so glad you mentioned that. It's so important, and just have so much appreciated the fact that that's been discussed in some of the national interviews about these new types of vaccines that are out there, that they can be adjusted. It reminds us of the importance of science and the importance of funding research. It is just amazing, and we hope to get more good news as we get more data about the vaccines. I have a question about the vaccines that a lot of people might be wondering about. What can you tell us that you've read about the side effects of the COVID-19 vaccine and how we can inform the public about those side effects without causing undue fear.
And I believe that we have to be clear. I don't think we should worry about fear. I believe that adults can make a decision based off what they know about the vaccine process. So not only have I read about what the side effects are, I've actually talked to healthcare professionals that have received the vaccine to get an idea and sense and feel of what they went through. So the most common side effect that I have read about is that people will get pain in the vaccination site. They will also have aches and pains, muscular aches and pains that are very flu-like in nature with the first vaccine. It is the second vaccine that it seems to be a little bit more pronounced. So you get more soreness in the arm. And I've heard from people that they actually felt like they were down with the flu for 24 hours. They just did not feel well. It was hard for them to go into work the next day. So I think you have to be prepared for that aspect, that with the second injection, you're going to have a little bit more in the way of side effects. Now, you can take over-the-counter medication to help with that, an anti-inflammatory, plenty of fluids, that always helps. I have heard from a few women that they've had issues of nausea, which I was a little surprised about, but it seems to be a common side effect also. We do know that there are certain subgroups that probably should not get the vaccine. And those are people that may have an extreme allergic reaction, people that carry EpiPens in their pocket. You probably should talk with your primary care physician about whether or not to get the vaccine in that situation.
Yeah. But of course, when these side effects happen, it just means that the vaccine is working, that your immune system is being activated. And like you, I've talked to some healthcare workers that have talked about those similar symptoms, and headaches. Headaches were another one that occurred for sometimes longer than 24 hours, maybe 48 hours or 72 hours, but then it goes away. And I think we can all relate to this, those of us who've gotten the flu shot. Some years I've gotten a flu shot and nothing. Other years, sore arm and maybe felt a little under the weather for 24 hours. I also got a vaccine for shingles, which there's a very effective vaccine for shingles, and I felt under the weather with that. You too?
Correct. Yes.
Okay, good. Very interesting stuff. Bobbie?
This raises an important issue about health equity. COVID-19 has exposed the issue of health insurance coverage in our state, and there's legislation pending right now in New Mexico for a universal health care plan. What are your thoughts about universal health care in New Mexico?
After working more than 3 decades here in New Mexico in healthcare, I think my thoughts have evolved. I initially was pretty much a big proponent of private insurance groups. But over the past 10 years at least, I noticed how difficult it is for a lot of families to get healthcare insurance. And the lack of coverage has been a problem, not only for minorities, but for regular individuals just trying to survive, young kids, college-bound kids. So I think that we need to really look at this again, and most likely, I'm going to let my personal side come out. I feel that I think we should go to some form of single payer. I really do. I think that may be the best option.
Yes, and of course, we've talked about this many times before on this program, and folks undoubtedly watching have heard this before on other programs, that almost every other major industrialized country in the world, including our neighbors to the north, Canada, have a single payer system. So the doctors in Canada, the hospitals are private, but there is a government system to pay for health care to ensure everyone is covered. And doctor, you're tied into this because you've served as a physician. You've seen people, I'm sure, who've struggled, who could not pay for the care that they needed. They may have sacrificed the getting care, delayed care, because they didn't have insurance, or because they had insurance but the co-pays were high and they were fearful of going into debt.
You really kind of hit something close to heart to me, because after greater than 3 decades of service here in New Mexico, I have been medical director there in Las Cruces at the Agri Cancer Center. I've been medical director in Santa Fe at one of the cancer centers there. I've also been medical director at the University of New Mexico in the radiation oncology department. So having served in this state and watching people go through therapy for cancer, it has been difficult to see some of the life choices and decisions they have to make regarding cost of medication, the overall cost of treatment. I have enjoyed my time at the university immensely. The patients that I get a chance to interact with have just been phenomenal, and I've always enjoyed that aspect. I've never liked the administrative aspect of medicine, but I've enjoyed the patient care.
Well,
so
we appreciate you sharing, Dr. Thompson, a little about that and about the COVID-19 equity issues and the vaccine with us today. We've run out of time, but it has been great talking with you today.
Thank you very much. I appreciate the time myself.
Dr. William Thompson and Bobbie Green, thank you both for being with us.
Always a pleasure. Thank you.
Thanks.
That is our time for now. Join us this week on KRWG Radio. Every weekday, it's Morning Edition from 5 to 9, Fresh Air at 11, followed by Here and Now, noon to 2, and All Things Considered, 4 to 7. KRWG News is always online at krwg.org, and we love to hear from you. Email us with your story ideas and video submissions. The address is feedback@nmsu.edu. For all of us at KRWG News, I'm Fred Martino. Have a good week. We'll see you next time on Newsmakers.